My presentation is looking at community perspective of progress in Ghana. Before my presentation, I want to thank my friend, Dr. Nashili and Yusuf of the Care Continuum for supporting me in putting the presentation together. Okay. I'm so short. Communities were the first responders to HIV 3 decades ago, and communities continue to be at the forefront in the fight against TB. Communities remain essential in advocating for a robust response to these epidemics, delivering services that can reach everyone in need, and tackling HIV and TB, related stigma, and discrimination. Working alongside public health and other systems, community responses are critical to the success and sustainability of the global response to HIV and TB. It has always been known that much of the critically important work in making progress in the response to HIV and implementing the 1990 fast-track targets can only be achieved with a strong community voice and presence. Success of civil society involvement in HIV response. Advocacy, social accountability. Existence of non-state actors for health undertaking high-level advocacy, formation and operationalization of social accountability committees, active involvement of community cadre within the community-based monitoring and feedback mechanism. These are very important strategies that Ghana is using and civil society is using. Research. Active involvement in the development of research agenda for KPs. In Ghana, research agenda has been very strong with civil society involvement. Active involvement in the cutting-edge research activities to inform HIV services in Ghana. IBBSS, civil society play a very big role during the data collection. Advocacy for government commitments to co-financing obligations of Global Fund and PEPFAR, civil society voice is very strong, playing our role. Advocacy for the operationalization of Ghana's AIDS Fund. We are very strong, calling government to invest and ensure that Ghana also has the AIDS Fund. With all this, civil society continue to play a very key role. Some of our successes in involvement of civil society in the HIV response. If you look at the map or the diagram on the left, the graph, is talking about the yield, our yield for key population under the USAID, the Care Continuum project. If you look at the age group, civil society has been able to use very innovative strategies, identifying key population at the hardest area in the community. And you can see the highest yield among 15 to 49 age group. It is the work of civil society under the USAID Care Continuum project. And if you look at the community-based service delivery, we continue to contribute towards the 1990, 98,018 MSM and 16,769 FSW were reached in 2018 with 10% and 15% yield for FSW and MSM respectively. It is the innovative and strategies that civil society used under the Care Continuum project. And if you look at the map under the MSM identification under the Care Continuum, I'm comparing this data with the Ghana Men Study. If you look at the Ghana Men Study, which is in orange, and look at the one that we have, which is under the work of civil society. If you look at the reach and the identification of MSM, the top one, civil society has been able to work and identify 9.6% against the 17.7% under the Ghana Men Study, because that is the measure. And also looking at the second slide, we have worked together as CSOs in Ghana, reaching 13.0% and 24.8%. So working closely, if you look at our match, it is not too different from what the Ghana Men Study is showing. And also if you look at the third one, which is 35.4% from the Care Continuum, and the Ghana Men Study, which is 37.8%, I think the match is very close, and comparing what civil society is contributing in this graph. Now, if you look at the overall picture, which is the work that civil society has done from just for 1 year, which is 2018 data of the Care Continuum project, we are 15.3% compared to the Ghana Men Study, which is 18.3%, very close under MSM. This is telling you that the issues, the problem is in the communities, and involvement of civil society to identify the hidden cases that nobody can get to is very important. And then comparing the same thing to FSW is also talking about the same graph, contribution of civil society and contribution of the work that we do. If you look at the overall picture of FSW, civil society has contributed to the identification of FSW 9.4%, the overall one, the down one in the corner, against the Ghana Men Study. Despite all this, civil society has some challenges. Our biggest challenge is inadequate involvement of civil society in implementation of national programs. Notion that civil society, especially NGOs, do not have adequate capacity to contribute. CSOs should be seen as partners. The CSO's view of Ghana's progress, despite gains made and the efforts made, more gains, we still need to do a lot. CSOs continue to lead implementation of key population interventions in Ghana. We still recollect FHI 360, the USAID strengthening the care continuum, and then the support of Global Fund in working in those areas. Having reached 71, 37, 66 of the 1990 targets is worrisome and unacceptable as a country. Having data telling us we have had a stagnant HIV response for over 4 years is worrisome and unacceptable. Still having so many missed TB cases is worrisome and unacceptable. Having MTCT rate of 7% is worrisome and unacceptable. Not being able to meet donors such as Global Fund and PEPFAR co-financing obligations is worrisome and unacceptable. Having been working on an AIDS fund for the past 4 years, that is still not operational is worrisome and unacceptable. In conclusion, whether advocates, providers, clients, participants in research or researchers, ourselves, CSOs, including community members, remain the foundation of AIDS and TB response. The goal of ending the AIDS epidemic and ending TB in our lifetime as public health threats by 2030 depends on transformed health systems that include significantly scale up community responses, and the funding and sustained support to make these responses possible. Thank you very much for listening to me.